On behalf of the Center for Environment and Public Policy and the Goldman School, I'm happy to welcome everybody to this interesting and important Commonwealth Club program. So how to think about what's coming. Humans have accommodated to all sorts of radiation over hundreds of thousands of years. Plain sunshine, which we occasionally get through the fog, cosmic rays to the bath of radio and TV we're sitting in right now. There's KGO, goes right there. We've also enjoyed amazing gifts from technology, from the abundant and convenient energy lighting this room and hauling us around, to the little computers that have shrunk from rooms full of vacuum tubes to something everyone here has in his pocket or handbag, and they can exchange information by radio with the whole world. Extraordinary. These little radios have, within the lifetime of the youngest people here, so this is a very short time, become so common and so useful that the reminder to turn off your cell phones has become the standard invocation for all public gatherings now. So every one of these new technologies, I should cue scary music now. Is the scary music coming? Every one of these new technologies has revealed itself to present risks that needed management by government policy. License plates for cars, getting the lead out of gasoline, building codes, ground fault interrupters for electricity, and so on. And some of these risks interact, like cell phones and driving, we're learning. Today's meeting occurs as similar questions about regulation and safety are put before us by scientific research about the electromagnetic radiation constantly sent out by these little radios that we carry and use next to our bodies, and the radiation Wi-Fi routers and cell phone towers spread through our environments. We don't know everything about these new risks, but we know enough, and I think this is the key insight for today, we know enough now to recognize that they're considerable. And I'm using the word considerable in its correct technical sense of needing or deserving consideration. This is an excellent time to start thinking about what government and industry should do, choosing from a rich menu of alternatives if these new radiation doses look hazardous enough to mitigate. Today, we will not spend a lot of time on policy questions, rather more on the science, but it's worth a minute to reflect that we did not outlaw electricity when a short circuit burned down the first house, or the first time a child put a hairpin in an outlet. Nor did we decide electricity was so wonderful that we'd let an unregulated market work its will and take whatever risks came with it. We developed rules and habits that allowed us to get the best possible combination of value and safety from this new technology. And that's the challenge that the research we're going to hear about today presents in the context of cell phones and Wi-Fi.
Thank you very much, Mike. And I have to say it's been a pleasure to work with you and others at the Goldman School as we start what will turn out to be a long and I think important journey. I'm going to talk to you today about cell phones and health and what the latest science has to show. Let me set the context for the morning and afternoon. The afternoon will consist of presentations on the science. We'll hear about sperm damage from studies that I'm going to summarize. We'll hear about prenatal damage from studies from Professor Hugh Taylor, who is the chairman of the Department of Obstetrics and Gynecology at Yale University, and from Suleiman Kaplan, who is professor in Samsun University, as well as director of science programs there and editor of one of their major journals. We will be hearing from Dr. Lisa Bailey, who is a breast surgeon in this area and may be known to many of you. She is coming to us literally from surgery, so we will hope she will be here soon. And she will be talking about some new evidence that she and colleagues have put together on the risks of breast cancer from keeping cell phones in the center of the bra. Then finally, we'll hear from Dr. Joel Moskowitz. Dr. Moskowitz has been absolutely invaluable to me in organizing this program and has done all of us a great service by regularly producing summaries of the science that has been produced. And so he's really a tremendous resource, and I would urge you to look at his blog and the materials that he has generated as well. After we hear the science, we will be breaking for lunch, and we will then have a discussion with Sushma Bhatia, who is with the city's Department of the Environment, and other policymakers who may wish to weigh in on the issue, who may be in the room at that time. I want to tell you it's a great honor for me to be here today, and really a thrill, because there are people in this room right now whom we all need to thank. And I want to say, Senator Mark Leno, I will ask you to stand, please, because you have been so instrumental in working on this issue. And had the foresight to recognize that when it comes to public policy, it's better to err on the side of preventing harm rather than proving danger. And we will have a further discussion about how the debate has often been framed as to, do we have the body count yet? And how the debate has been about brain cancer. Do we have enough proof of brain cancer? That's the wrong question. We are conducting an experiment right now on all of ourselves and our children and my grandchildren. We're conducting an experiment precisely because we do not have data on safety. It never was obtained. And rather than debating whether we have definitive proof of harm, we should be asking, is there sufficient evidence to consider, as my colleague Professor O'Hare just said, is there sufficient evidence to consider that prudent precautionary policies are appropriate? And I think after you hear our presentation today, you will say yes. And I'm delighted that Senator Leno had the vision to understand the importance of precaution as a policy instrument. Sushma Bhatia is here. Sushma was here. She'll be back in a moment. She is with the city's Department of the Environment, and she is heading their program now to try to implement these activities, one of which is environmentally preferable purchasing. The city unanimously passed the cell phone right to know law in 2010. That was a fact. They did it based on the judgment of the Board of Supervisors at that time that there was enough evidence of potential harm that it was prudent to let people know how to be safer. That law was struck down in part, but not in toto. So in 2013, the city attorney of San Francisco wrote to the FCC specifically urging them to undertake a comprehensive review of current radio frequency standards, to develop new standards that would protect children and particularly reflect current use patterns of phones. Now, just a brief overview of electromagnetic fields. Visible light, which allows us all to see one another, is right in this part of the spectrum. The electricity that allows us to get the room lit is down here, the long radio lays. Well, if we look at where microwaves are, they are further out, here. Microwave radiation is right here. And what uses microwave radiation in frequency is a cell phone. A cell phone is a two-way microwave radio. That's what it is. It uses the same frequency as a microwave oven, but it uses much, much less power. So as a consequence, it was thought by some that the weakness of the signal meant it could have no effect. We will show you today that that assumption is wrong, and that the power of the cell phone, which is indeed weak, is not its most biologically important characteristic. Rather, it is its disruptive nature, the fact that the cell signal can be very erratic, that it goes on and off. If you think of yourself riding in a bus or an airplane, it's vibrating, resonating, and you can read. But if it suddenly stops or lurches or turns, it disturbs your normal balance. And that is what we think may be going on to cause a stress response within your proteins and genes that then produces a cascade of harmful agents throughout the body. Just to make it clear, the complexity of radiation really depends on the nature of the waves. So often you'll see studies that show a positive effect, and there may well be positive effects from this radiation, when you're doing continuous exposure. Continuous exposure can be used to heal. And there are studies now, and there are applications in medicine using this frequency to heal that have been approved by the FDA. But the variation in pulse and wavelength may be most important. And the most important thing I want to share with you now is that the standards for your cell phones today have not changed in 17 years. Now, would you want to fly in an airplane that was flying with 17-year-old safety standards? How'd you like to put your kid in a car seat that was complying with 17-year-old safety standards? Or maybe a bike helmet with 17-year-old safety standards? That is why we think it's time for the FCC to change its approach. The original standards for cell phones were set 17 years ago, and they were designed simply to avoid heating. That was considered the only effect that was of concern. This is what happens in the course of a 4-minute phone call. The variation in volts per meter is a measure of power density. As your phone is on standby, it's down here low. As you go to answer it, you go to max power. And this max power, when you answer the phone goes to the max power, is the worst time for you to have the phone directly next to your head. As you speak throughout the call and you listen, remember, this is 4 seconds. This is 4 seconds of change in power density in the phone, and half of the radiation from the phone, the way phones are designed today, gets into your brain. The standards were developed to avoid heating a heavy-set man, not a young child, and certainly not infants and toddlers, as we will see, who are being given phones as though they are pacifiers today. I'm going to briefly talk to you about some of the experiments that have been done with human sperm. Sperm have the virtue of being readily available, and it takes about 500 million to make a healthy child. That's because you want the healthiest sperm to succeed in fertilizing the egg. These studies I'm going to show you took sperm from healthy men. One test tube did not get exposed to cell phone radiation, and the other did. And what the results were quite stunning. Sperm exposed to cell phone radiation died 3 times faster. 3 times faster. And in terms of a measure of damage on their mitochondria, had 3 times more damage to the mitochondrial DNA, just from cell phone exposure. Further studies have looked at the motility, that's the ability of the sperm to swim, and how healthy they look in other indicators. And in all of those, the sperm exposed to cell phone radiation are sicker, they die faster, and there are fewer of them. And this is not one study, but several studies. An observational study conducted by the Cleveland Clinic by Ashok Agarwal, a very distinguished expert in male health, has shown that men who keep cell phones in their pocket at that time for 4 hours a day have sperm count about half those who reported little use of cell phones. Now, you often hear about how we have extensive literature on this issue, thousands of studies and thousands of studies. Well, that's actually not true. And I'm reporting to you here that as of December 8th, 2013, on the website run by the German government called EMF Portal, there are 474 studies in toto on the experimental impacts of radio frequency or lower electromagnetic field on cells. And they are 797 studies on young animals. That's it. The idea that we have thousands of studies is actually not true. The other thing that I'm pleased to tell you is that after San Francisco passed its warnings, its law, the iPhone implemented a warning system. May I ask how many of you have iPhones with you today? And how many, if they are on, but on airplane mode, that's the best thing to do. Lisa, please come on up. Perfect. If they're on airplane mode, go to settings. And when you go to settings, you can go from settings to general, then about, and then scroll all the way down to legal, and finally, at the bottom of legal, you get RF regulatory. And it will tell you in the phone a variation of what you see here. iPhone's SAR measurement may exceed the FCC exposure guidelines for body-worn operation if you keep it in your pocket. That's the warning that's now with phones. Very few people are aware of that. It exceeds the as-tested exposure guidelines if you keep it in your pocket. And the BlackBerry says if you have an implanted pacemaker, you should keep the device at least 7.8 inches from the chest. Now, the American Academy of Pediatrics, which we'll hear from Dr. Taylor about, recommends that children under age 2 have limited to no screen time. And yet the companies are busy producing potty seats and baby bouncer chairs that can hold iPads right in front of the developing brain. If you must give a young child such a device, and I would encourage you not to, but if you must, please put it on airplane mode. Please make sure it's not sending the signal back and forth to Wi-Fi while a child is playing with it. It's a bad idea. Here's another device, a plastic baby iPhone rattle case. And it says very proudly, protects the phone from the baby. Protects the phone from the baby's drool and dribble. And I'm sure it does. But again, this is not a good idea for developing brains, as we'll hear. The advertising shows children using phones close to their brains and bodies, even though the warning comes in the phone that you should keep it away from your body. Now, I want to show you what's been diagnosed in Korea recently. Digital dementia has been diagnosed in children. It involves memory problems, difficulty handwriting, difficulty looking you in the eye, difficulty developing empathy, and it's a diagnosed brain condition confirmed by MRI scans of these children. This is not some Saturday Night Live joke. This is the future of the brains of the world's children. The hemisphere of the brain, the right hemisphere, which is what allows us to be empathic and to understand things, is underdeveloped. And it's such a concern that the Korean government has issued warnings. This is what Turkey has done, and we'll hear more about that shortly. Governor Aksoy Hussein of Samsun is launching a cell phone campaign, thanks to Professor Suleiman Kaplan, to give information to people about how to use phones safely. Belgium, the public health minister, has banned the sale of phones to children under the age of 7. And Australia has recently issued more advice as well. Toronto has limited Wi-Fi in public parks so far, and in the United States, a number of towns have issued proclamations of cell phone safety awareness. I think proclamations may be a route that one cannot object to, and it allows us to have campaigns to promote things like this. Save the girls. We are now, and you can get these materials from our website to share. This is to warn about the breast cancer risk. Or practice safe tech, do it with wires. These are small cards that we're going to make available that you can hand to young parents to explain to them that device manufacturers advise keeping phones away. All of us care about children. So this is one of the things in our knowledge transfer toolkit that you can download from our website. And I really look forward to how we will be able to work together now to come up with practical things you can do. We're not opposed to this technology. We just want you to be smart. It's really not a smartphone if it harms brain cells. So this is some of the simple advice. Use a speakerphone, use earpieces, and avoid using the phone in weak areas where the signal is weak, because the phone has to work harder getting into you and your body. Well, I want to conclude with a special thanks to David Servan-Schreiber. David wrote the preface to my book, and here's how he ended it. We don't want to believe that our new toys, which bring enormous profits, could also cause our demise or that of our children. But science is not about belief. Government's responsibility to their citizens should not be either. He died at age 50. Until he and I had dinner in 2007, he was a very, very heavy cell phone user. He owned 3 phones. He was on the phone the moment the wheels hit the tarmac. And with all of his knowledge and information about anti-cancer, he could not spare his own life. So I want to recognize that although we can't prove in many cases what happened in his case, I believe that cell phone radiation was a major cause of the brain cancer that took his life at age 50 and took from us a great shining light in the field of public health. Thank you.